When did you have your surgery?
My anniversary was November the 8th, 3 years ago.
Okay, so you're 3 years out. Almost just last week.
Exactly.
All right. And how much weight have you lost?
Right at 90. Maybe a little more.
Yeah. Well, that's great. And you were saying that you dress size changed?
I went from a 24W to 8s and 10s.
Wow, that's great.
That's wonderful.
Makes you feel good.
Absolutely.
And what else has it done for you in terms of what you can do or can't do?
It has just given me so much of my life back, and I would say quality of life. I have 3 grandchildren now. My first grandchild I couldn't get in the floor and do like I wanted to with him. Now with these other 2, I can run, get outside and play. I can hold out to do with them. I can get even in the floor with them. It's just open up a whole new world.
Yeah.
Whole new world.
That's great. What about any medication changes or anything like that?
I actually take no longer. It dropped 6.5 pills for me. Some that I took more than one a day, so it was actually more. But I'll say 6.5 prescriptions.
So what prescriptions were you able to get rid of?
Glucoflage, Actose, which was for diabetic.
So diabetes gone?
Gone.
High blood pressure?
Gone.
Wow.
Nothing.
That is great.
I was on actually 2 different types of things for high blood pressure.
So two pills for high blood pressure and 2 pills for diabetes, all gone.
All gone.
You know,
and Lasix.
Yeah. You know, I'll tell you, getting people off their diabetes medicine and putting diabetes in remission, that really, really excites me more than anything.
In fact, more than anything, I have to watch it falling down.
Getting too low.
Too low.
That's interesting.
Too low.
Okay, now let's talk a little bit about the surgery. You outpatient?
Went home the same day.
Yeah. How about the fills? Now you're 3 years out. How often do you have to get a fill?
Actually, I had not had a fill. I didn't realize it had been as long. I just came back in October, and it had been almost a little over 9 months.
Yeah. So you're in that plateau period. You're right where you want to be.
My goal was 100, and I'd still like to reach my goal. And I really thought way before now I would have as good as I've done. But I haven't, and I'm not worried about it. I've got still the rest of my life. Right. Thank God I have so much more quality of life now.
Well,
and
that's a good point. So your goal is 100 pounds. You're at 90, but you've gotten rid of your blood pressure medicine. Your blood, 190. It's not that, and you're plateauing now, so it's pretty easy. You get your fills every now and then, just to kind of maintain.
Right.
Yeah. So all in all, how is the experience over at the bariatric center?
Everybody is wonderful. I cannot say enough. One time I came and thought I needed a fill and didn't quite need as much as we got. And I had to have some removed, and they were wonderful. I came back and they met me back after hours and took care of me, made sure I was all right before I left. There's been a couple of times I'd say, okay, I want to come early to make sure that I'm going to be okay, because once you've had that experience, you don't want it again. And as far as I live away, I don't want to have to come back again either. So I'll get my appointments early. I'll do around here in town. Love to, always an excuse to go shopping. And if I see I'm okay, I go on home. If I'm not, I'll run back by.
Perfect. That's exactly the way you're supposed to do it.
And they've just been as helpful and as generous. I can't say anything but positive about the whole setup. It's been wonderful.
Good. You look fabulous.
Thank you very much. Thank you very much.
And I appreciate you doing this. It helps us a lot.
I feel honored.
Well, people, so we're doing our website, and I really want patients to connect with other patients. And I always tell people, if you know somebody who's had a band, contact them, talk to them. It makes a lot of difference.
Well,